Inserting a core flow tube. Parents can insert a core flow tube once the stoma is 3 months old or after the doctor has changed the surgical tube to a Mickey or Nutriport G-tube. Core flow tube is inserted if you do not have a spare G-tube or if the stoma has shrunk and you are unable to insert the current size G-tube. The core flow tube is one size smaller than the G-tube your child has in the stoma. The smallest core flow is 12 French. Thus, if your child has a 12 French G-tube, the core flow kit will be the same size. The core flow kit and insertion instructions should be with your child every place he goes, including to and from school. Parents have to discuss with each school if staff are able to insert G-tubes. The stoma shrinks slowly over several hours, so don't panic. You have time to insert core flow tube safely. The core flow kit contains the core flow G-tube, lubricant, pre-filled syringe with 10 ml water, feeding extension, and dry gauze. Wash your hands. Put non-latex gloves on. Gloves are only required in hospital settings. Open the core flow kit. Close the feeding tube end to prevent leakage. Insert the syringe into the balloon port and insert 5 ml water to check the integrity of the balloon. If your core flow kit is 12 French, fill the balloon with the same amount of water that is in your child's G-tube, 3 to 5 ml maximum of water. Check the balloon is completely inflated. No water leaks from the balloon and the valve is working. If the balloon is stuck on one side, rub the balloon gently between your fingers to release it. Once you have checked the balloon, remove the water. Keep the syringe nearby. Lubricate the end of the tube. Move the disc up and down the tube to lubricate. To determine how far to insert the core flow tube, note the length of the current G-tube. Add 1 centimeter to that length. Move the bottom of the disc to that measurement. The disc will be your mark to stop at. Lay your child on his back comfortably, or have someone hold your child. Try any calming techniques that work for your child, such as soother, music, or soft calming voices. The tube will go in easier if the child is relaxed and not crying. Put the lubricated tube tip into the G-tube stoma. Gently push the tip of the tube into the stoma. If you feel resistance, gently rotate and push down. Also, if your child is crying, his abdominal muscles are tight. Hold gentle downward pressure on the tube and wait till he takes a breath in and push down gently till the tube goes into the stoma and the bottom of the disc touches the skin. Use the pre-filled syringe to fill the balloon with the correct amount of water. Make sure the tube can easily turn full circle, 360 degrees. Pull gently up on the core flow tube until you feel resistance. This will bring the balloon up against the stomach wall. Slide the bumper down the tube until it almost touches the skin of the abdomen. The disc should be 1 to 2 millimeters above the skin, or the thickness of a dime above the skin. Check the placement of the tube by attaching the feeding extension to the feeding port of the tube. Insert the syringe into the extension. Pull back gently on the syringe plunger and try to withdraw fluid from the stomach. If you cannot get any stomach fluids, turn the child onto his side and try again. Or if the child is allowed to drink, have them drink some fluid and try again. Only in hospital a pH test is required to confirm placement. Once placement is confirmed, flush the core flow with a minimum of 10 ml or more of water. Use a flexi-track or standard medical tape and secure the tube to the abdomen. If you are unable to withdraw stomach contents, do not use the tube. Take your child to the nearest emergency room or call your doctor.